If your dog is facing separation anxiety, chronic anxiety, aggression, compulsive disorders, perhaps your dog hurts himself or others around sensitive triggers, then maybe you've started considering behavior meds. But perhaps you've heard that medications for dogs make them into zombies and make them go crazy. Or maybe you just don't know enough about the subject at all to even form an opinion. Well, then this video is for you, because today we are talking about behavior meds and how they can help your dog. And by the end of this video, you'll have a better idea of whether or not it's time to talk to your vet about potentially putting your dog on a behavior med for his anxiety. So if you're interested in learning more, keep watching. What's up, guys? It's Jenna with Dog Liaison, where I coach you on how to enhance your dog's mental health. And on this channel, we break down scientific research in order to inform and educate us on how to train dogs. So if you're interested in a nerdier approach to dog training, make sure to hit that subscribe button. Now, I want to be very clear right out of the get-go that I am not a veterinarian, and so the purpose of this video is not to help you diagnose your dog or to walk away knowing exactly which behavior med is the right choice for you. That's not what you're getting out of this video. What we are going to talk about today is whether or not the conversation is even applicable to you. By the end of this video, I hope that you have a little bit more breadth of knowledge, a little bit more awareness of how behavior meds work and how they might be the right fit for you and your dog. With that said, this video was created with the generous help of Michelle Borchardt, who was very generous in giving me her information and lending her expertise to us. Michelle works at the behavior service at UC Davis Veterinary Teaching Hospital, and she is a registered veterinary technician, a Pryor Certified Professional Trainer, a Fear-Free professional trainer. She works closely with 2 Board Certified Veterinary Behaviorists, and she's also a co-author of current studies examining specifically behavior meds. Plus, Michelle also made a wonderful presentation that I'm going to link in the description box below for you, and it goes over a lot of what we discussed today, some in more detail. So I definitely recommend that if this is a topic that you find more interest in, you check that link out. Let's get into it. So what are behavior meds and what is their purpose? Well, the very general, maybe oversimplified answer to that question is that behavior meds minimize the amount of stress or minimize the amount of anxiety that a dog can experience. Now, of course, stress is very normal. Every dog, every species for that matter, experiences stress, and that doesn't necessarily mean that every dog needs medication in order to regulate that stress, of course. However, if your dog is experiencing frequent bouts of anxiety, frequent bouts of stress, then it may impact the quality of life for your dog because they're not able to cope with that amount of stress that frequently in their life. Or perhaps their perception of a trigger, of a scary thing, is disproportionate to what it really should be. And now you might be thinking, but isn't that what training's for? That's why I'm training my dogs, to get his response more proportionate. Isn't that what I'm doing when I'm training my dog? And yes, absolutely, training protocols are necessary, and behavior meds are never supposed to replace the need for a training protocol. But if your dog is constantly going over threshold, lunging, pulling, barking, scared underneath the table, his brain is not conducive to learning. He is not going to be able to absorb that information in that moment. So we want to limit his perception of that threat, that he stays in a mental state where he is actually able to absorb the learning protocol that you're implementing. And the behavior meds do this by making sure that your dog's serotonin is always readily available. Now, serotonin is also known the calming chemical, and it is the neurotransmitter that allows us all to feel content and calm. And so when this supply is always available to your dog, he is able to feel calmer for longer periods of time in these more stressful situations, so that your dog can actually think, your dog can actually learn. Now, this might be sounding really good to you, but perhaps you've heard that some medications make dogs really zombie-like and out of it. And to be completely honest, yes, some medications will make your dog more drowsy. Some medications will have a sedating effect, but that's not always a bad thing. Michelle told me Some medications are given specifically to be sedating. If your dog is going to the vet, groomer, boarder facility, or has hyperattachment issues, it's best they feel very relaxed or even sleep to prevent stress, destructiveness, or aggression in triggering situations. These medications are only given as needed since they often make dogs drowsy. Now, we're going to talk about as needed medications in just a second, but one thing that I do want to emphasize is that dosage, how much your dog gets of a certain medication, will play a factor in how drowsy your dog is. If you don't need a drowsy dog, if your goal is to have an awake, very conscious, active dog, then there are options for you. There are doses for you that you just need to relay that to your vet and have that discussion with your vet in order to find the right fit for you and your dog. Now, before you try behavior medications for your dog, you might feel more comfortable starting off with supplements like dog appeasing pheromone spray, or perhaps a special diet that is supposed to calm your dog, or try melatonin. These are other supplements that are readily available. You can usually find them at a common dog pet store. But Michelle does want to emphasize that these are usually things that are for mild cases, and you need to make sure that you have reasonable expectations when you use them, because they're not meant for serious or chronic stress. And the other thing to remember is, like we talked about in this video, some of the reported positive effects of things like dog appeasing pheromone spray actually fall under the placebo effect. And sometimes owners think that it's helping more than it actually is. So you just want to go in using those with reasonable expectations. So if you're still not sure whether or not your dog's stress is significant enough to consider behavior meds, these are some things that you can ask yourself to determine whether or not a consultation with your vet is necessary. Michelle recommends that you talk to a vet about behavior meds if your dog is showing symptoms which are interfering with his quality of life. That is, that the pet is unable to do or enjoy normal things such as walks, play, social interactions with family. If your dog has undergone training but he's plateaued. If your dog is injuring himself during panic, then you definitely need to go talk to your vet. If your dog's anxiety is moderate to severe. And if your dog is having behavioral issues like aggression, then you need to take your dog to the vet so that your vet can determine and rule out any physical issues such as pain, neurological problems, oral issues, etc. And that is something that we talked about in this video. So if you're interested in a little bit more information on that, check out that video. So at this point, if you're thinking, yes, I need to take my dog into the vet to have this conversation with him and see if behavior meds are necessary, then there are a couple of things that you need to know going in to that appointment to make sure that it's productive. First, Michelle really wants you to schedule an appointment solely to discuss the behavior issues with your vet. Please do not, go in for your usual vaccines and then on the way out while you're checking out, in the lobby, you're like, oh, by the way, my dog bites people. That's not the way to do it. Something to realize is that your vet, in order to be productive, in order to really help you, is going to need to ask several questions, and that could take time. So please allot an entire appointment, an entire session to this issue with your vet so that they can really get into the conversation and understand what's going on. When you do go into your appointment, then Michelle wants to make sure that you tell your vet specific information in order to help your vet out the most. She suggests you tell your vet when and where does the behavior happen? Is there a noticeable trigger? If so, what is it? How often does this behavior happen? What is the fallout from this happening? Why do you think the event is happening? What have you done to try to mitigate it, and how has that affected the behavior? Have you sought the help of a trainer or other person to fix the problem? If so, who? And remember, on this channel, we really recommend positive reinforcement trainers. Are there any legal issues which have occurred due to this behavior? Personally, I recommend writing all of that information down on a piece of paper ahead of time when you go into your appointment. This is something that a veterinary behaviorist, Dr. Chris Pockel, recommends as well. He actually did a recent podcast that was a really great episode, and I'm going to link all that information in the description box below so that if you're interested in having more information on this topic, you can hear it straight from him. He's a wonderful veterinary behaviorist, and it's an excellent episode. Ultimately, if you and your vet decide that behavior meds are necessary for your dog, then there are a couple of things that you need to know. First, there are basically two separate categories of behavior meds. There's as needed, in which the effects of the medication occur right away. You give it to them, and within a couple of 45 minutes or so, you start to see the effects. But it also wears off typically around 8 hours. And this can be likened to sort of like a Tylenol, where you're gonna see the effects as long as it's in your system, but as long as it's out, you're not gonna see the effects anymore. Then there are daily medications, which must be taken consistently every single day in order to be effective, and there is an onboarding period. It usually takes about 4 to 6 weeks before you start to see the effects of the behavior meds in the dog system. If you give it to them tomorrow, you're not gonna see drastic change. It takes time for it to stick in their system. So how does the vet determine which medication is necessary for you and your dog? We like to use the drug with the least side effects, but is also most likely to work for the pet and its issues. This is where practicing medicine comes in, because it's a judgment call by the veterinarian based on the pet owner, situation, symptoms, other drugs that it may interact with, dosing, cost, side effects, FDA approval, and so much more. There's no single go-to for each condition. Because it's a judgment call on part of your veterinarian, it's very important that you are giving your vet as much information about your dog as possible so that they can take all of that into consideration when they're prescribing. Now, if you're interested in learning more about these distinct types of behavior meds, what they're called, how they precisely function in your dog, then I recommend you hit that subscribe button, because in my next video, I am going to be doing a deep dive on some of the common behavior meds that vets prescribe. And if you are watching this video well into the future, then I've already linked it here and you can watch that now. If you enjoyed this video, make sure to hit the like button so that the algorithm is aware, and I'll see you guys in my next video.